Hello, my dear students. I'm Dr. Vaishali Bharambe, Professor Anatomy. You've probably just taken admission in medical college and you've just been taught the basic anatomical terminologies, and that's what I'm going to run through today. I hope you understand, and do please feel free to put down your comments, your doubts, and I'll be happy to get back to you. Come, let's begin. This lecture is going to cover positions, planes, and general anatomical terms. So what are we going to learn? Normal anatomical position, other positions in which patients are put, something about the planes, and some terms. I'm going to try and make it as simple as possible. Just relax and learn. Positions of the body. First, of course, the normal anatomical position. I suggest that you do this thing, okay? So stand straight like this person. Have your arms at your sides. Your toes facing forwards, stand tall, look straight ahead. That's the normal anatomical position. Why are we talking about this? See, when I ask you to flex your arm, okay, if the starting point was like this, would you be able to flex? No. So there has to be a fixed starting point for any action. This normal anatomical position is the fixed starting point for any action. Okay, so what is it like? Standing erect, face forwards, head and eyes looking straight, palms forward, thumbs laterally, toes forward. That's the normal anatomical position. I'm sure the image is giving you the general idea. So let's talk about some simple terms, supine and prone. I'm sure you know what is supine. Supine is when you lie down on your back. See the sweet little baby lying on his back? Lady lying on her back, that's supine. So many times when your patient comes into the OPD and is very ill, he may come in a supine position, right? Versus a prone position is when the patient is lying on the front part of his or her body. Some patients sleep in this position. Some patients have to lie in this position because they may have a back injury. There's so many reasons for a patient to lie in prone position. Okay, so these are terms you need to understand. Lateral position, the position in which many of you sleep with an arm under your head on the side, the same side leg on the bed, and the other side leg may be flexed. This is a lateral position. Okay, the upper leg is usually slightly flexed to maintain balance and steadiness of the position. When would you give this position to your patient? Maybe patient is comfortable in this. Maybe you want to do a rectal examination. You want to examine something. So that's when you give patients this position. Many times, specifically Sims position is the word used. See this term here? Sims position. So this is similar to the lateral position. The leg on the bed is straight and the leg on the top is flexed and resting on the bed as seen here. So much so that the gluteal region and the rectal region is quite well exposed. This is when this is the position given when you want to do a rectal examination, give enema to the patient. Okay, that's when this position is given. Students, if you're liking this lecture, do please like, share and subscribe to my channel and hit that bell icon. For detailed anatomy lectures with diagrams, surgical anatomy videos, downloadable notes, MCQs, visit my website vbanatomy.com. Link is in the description section. Come. So what's the next position? This looks familiar. I'm sure many of you know what this is. This is lithotomy position. When do you put a patient in lithotomy? Think. Obviously, when the patient is delivering a baby, when you're examining the patient's perineal region, that's when you want your patient in this position, right? So pelvic and perineal manipulations, that's when you have this. So sometimes even urological manipulation, you want your patient in this position. What is it called? Lithotomy position. Fowler position, when the patient is lying partly up, as shown in this image. So this is a very restful position for patients. Many times the nurses will come put patient in a Fowler position for giving food, for even sometimes just talking with the patient. Okay, so Fowler position is quite often used in hospitals. Patient is quite comfortable breathing in this position. Next, Trendelenburg. In common man language, what would you call Trendelenburg? Think. Head low? Absolutely. So, when the head is low and the feet are high, when you want more blood to go to the patient's head, you put patient in this position, which is called Trendelenburg position. What is it called? Trendelenburg position. You will often put patient in this position when you're doing abdominal or pelvic surgeries, so the blood will go further inferiorly, or even in shock management. So what is reverse Trendelenburg? Obviously, the feet are lower and the head is higher. When would you put the patient in this position? You want to operate on the head neck region. You want more blood to go down. That's when you do this. Thyroid gallbladder surgeries. So with this, we've finished quite a few positions. Normal anatomical position, lateral position, Sims position, Fowler's position, Trendelenburg, reverse Trendelenburg, lithotomy. See if you can remember all this. Okay? Come. Now we go to planes of the body. I'm sure it was taught you in college, so we're just going to run through it quickly. If I pass a plane through the midline of the body in such a way that my body gets divided into right and left sides, that plane is called median sagittal plane. Okay? Right through the middle of your body. But if you pass it horizontally, if you pass it like this, perpendicular to the median plane, dividing your body into anterior and posterior, then that is called as a coronal plane. Median sagittal plane, coronal plane are perpendicular to each other. And were I to draw horizontal sections as shown here, these are horizontal or transverse planes. Now, why is it important to discuss a horizontal plane? So, understand that what is CT scan? What is the relation of this to horizontal plane? I've given you a hint. See if you can understand. CT scan are horizontal sections taken of the body at very minimal distance. Okay? And if you want to be able to interpret a CT scan, you have to know structures present at every horizontal level in the body. Were I to take a section here, what would you get inside my chest? Would you get lung? Would you get heart? Or would you get liver? So, knowing horizontal sections is very important if you want to interpret CT scans in future. Okay, so that's the plane. Which planes do you have to remember? Median sagittal plane, coronal plane, and horizontal planes. Horizontal are multiple. There are hundreds of horizontal planes. Okay, one below the other, one below the other, one below the other. Okay. So, what's a median plane? This one. What's a paramedian plane? Any paramedian plane is a sagittal plane drawn parallel to the median sagittal plane. Median sagittal, paramedian 1, paramedian 2, paramedian 3, parallel to the median sagittal plane on either side of it. So, now we've talked about planes also. First we talked about positions, then we talked about planes. Let's now talk about some fantastic terminologies. Okay, first anterior posterior. You will feel that, ma'am, I know all these things. I'm glad if you know. But in case you don't know, then let's run through it once. Okay, so here's a lady. Anything to the front of her body is anterior. Anything to the back of her body is posterior. Anterior, posterior. Okay, so this is a very relative term. So now can you point out the anterior part of your arm and the posterior part of your arm? This is my arm. So this part becomes anterior and this part becomes posterior. Got it? Now, this is this lady's median sagittal plane. Okay, first orient yourself to that. Anything, any part of the body closer to the median sagittal plane is medial. Anything away from it is lateral. So what is this and what is this? This arrow is lateral, away from the median striatal plane. This arrow is medial, closer to the median sagittal plane. Again, medial and lateral are very relative terms. Okay. Let's take an example. Take your hand, everyone. Okay. Now, this is your little finger. This is your ring finger. Little finger is medial. Ring finger is lateral. Correct? But now this is your index finger. This is your ring finger. Now ring becomes medial and index becomes lateral. So medial and lateral are very relative terms. Okay. Right. Let's talk about superior and inferior. It's not like I am superior, you are inferior. No, it's a different way of using these terms. Like the top of her head is superior to her neck. Up and down, that kind of a relationship this word is used in. Okay. Superior, inferior. Again, as you go down, something else becomes superior and something else becomes inferior. Now, proximal and distal. Think, what do these words mean? Proximal, closer to the body. Distal, away from the body. Okay. So now look at the arrows. Elbow, wrist. Who is proximal? Who is distal? Elbow is obviously proximal. Wrist is distal. Correct? But now there's an arrow coming at the shoulder. Who is proximal now? Shoulder. Who is distal? Wrist as well as elbow. Both become distal. These are all relative terms. Try to understand the use of these words. So here's a baby and we're talking about cranial and caudal. Cranial and caudal are terms related to the torso. Anything closer to the head is cranial. Anything closer to your tail is caudal. Okay. So actually we as humans have lost our tail. But that tail end of your back is caudal. So this is cranial. This is caudal. Got it? Right. Internal and external. Now this is again common sense. Relax, have some water. Those of you who watch my videos regularly will know that I love having my coffee. I love making you people relax in my videos because stressful education is not fun education. And for people like you who are going to have a long journey in medicine, you have to learn a method of fun education. Don't force yourself to study. How much can you force yourself? Relax, have water, have coffee, tea, whatever rocks your boat. So we're now talking about internal and external. Okay. So I'm seeing liver, I'm seeing small intestine, I'm seeing skin. Who is internal? Who is external? Obviously, liver, small intestine are inside the body and are internal organs. Skin is outside the body and is an external organ. So these are basically use of English language. Right. So can you explain with examples the terms medial, lateral, superior, inferior, external, internal? Right. So let's try this. Okay. Medial, my body is medial compared to my arm. Correct? Okay. Superior, inferior. My neck is superior. My abdominal wall is inferior. Correct? Okay. Internal and external. My brain is an internal organ. My nose is an external organ. Okay? Fine. This is how we do these small activities. Okay? Palmar dorsal, plantar dorsal. This is my palm. This aspect of my hand is called palmar aspect. Whereas the dark side of my hand is my dorsal. D for dark, D for dorsal. This is palmar, this is dorsal. This is palmar, this is dorsal. Same thing works for your feet as well. The dark side of your feet is dorsal. The pale side is your plantar. The sole that rests on the ground is plantar. But the dark side of your feet is dorsal. Okay? Use these terms regularly, you will get in the hang of it. So this is palmar, this is plantar. Right. Let's talk about ventral and dorsal. Now understand that. Again, a baby. Fun. Okay. So now look how sweet the baby is. I hope you, in your journey, you start to enjoy meeting these babies. They're just born and they're so angry to be outside. And yet in your heart of hearts, you're so happy to see them. Because when the baby is out and crying, it essentially means that there is a live birth, which is what your job is. Right? Okay. We're digressing from the topic. So anything which is related to the front end is called as ventral. See, we were quadrupeds. It's we who have stood up. Remember that. We were actually walking on 4 feet. Later, we've started to become bipeds, walking on 2 feet, right? So this part of the dog, which is facing the ground, this part of the cow, which is facing the ground, is ventral. Because we stood up, this part of our body is ventral and the opposite side, the back of the dog, the back of the cow, the back of the man is dorsal. Ventral dorsal are embryological terms which we less commonly use for an adult and more commonly we use for during embryology. So this has an evolutionary orientation. I hope you enjoyed that. Right. So if you're liking this lecture, do please like, share and subscribe to my channel and hit that bell icon. So let's come to superficial and deep. For this, I'm going to take a section through the thigh. Which section am I taking? Obviously, horizontal section. I've taken a horizontal section through the thigh. Now observe what I'm doing. This is skin. This is superficial fascia below that. This is deep fascia. This is muscle. This is femur. Question. Who is superficial? Skin or deep fascia? Obviously, skin. But who is superficial? Deep fascia or muscle? Deep fascia. Who is deep? Femur or muscle? Femur. So, superficial and deep are again very relative terms. So, we have finished the first of the common terminology series. You should be very happy with yourself. But the lecture continues. We've still got a little bit to go. Ipsilateral, contralateral. What are these? Now, here will be a little bit difficult for you. So, ipsilateral means the same side. So, my right hand and my right leg are ipsilateral. Contralateral means opposite sides. So, my right arm and my left leg are contralateral. When do we use these terms? Understand that. Sometimes, the person gets a stroke. Okay. So, what happens is, he has paralysis of one side. See, you can see it in her. One side face is paralyzed. The other side body is paralyzed. Okay. So, the lesion is on the left and the left side face is paralyzed. So, ipsilateral facial paralysis. But lesion is on the left and the right side body is paralyzed. So, we say contralateral hemiplegia. These terms will be used by you so often. It's only that I have the job of introducing them to you today. Ipsilateral, same side. Contralateral, opposite sides. The last terminology we're going to learn today, I want to take you to that day when you had a birthday party. And your house was decorated with balloons. I'm finally exhausted, enjoying, observing all those fantastic gifts that you got. You finally went to sleep. You woke up in the morning, the balloon was still there. It was slightly less, it was a little soft now. But it wasn't like it had burst open. No, the air was still there inside. So, if you put your finger inside that balloon, did you rupture the balloon? No. Your finger just goes in. But the balloon remains intact. You just have a depression in it, like this. This is called as invagination. It's called as invagination. Whereas, when you take the balloon and you twist it and you have a little round part of it extending outside, that is called evagination. Evagination. So, best way to understand invagination is how lungs develop. In your chest, there are two cavities called pleural cavities. These are your lungs which slowly begin to invaginate into them. Till finally you have a lung surrounded by the pleural cavity. But has the lung entered inside the sac, pleural sac? No. It has just invaginated into it. Okay, so this is how your lungs develop. Right. So for more of such detailed anatomy lectures with diagrams, for surgical anatomy videos, downloadable notes and MCQs, please visit www.vbanatomy.com. Link is in the description section. Thank you, students. I'll see you across in my next video, which is again Terminologies of Anatomy Part 2. This time we'll be discussing movements. Bye.